Well, the benefit of an international program like this is really you are taken out of your small training environment and really given a big picture world view of what the state of healthcare is outside of where you work. These women have such a strength, and you see that, if you go visit the gynecology ward and you see some women have some cots and other women have mattresses on the floor and some women are sleeping outside, and occasionally there's a patient who doesn't have a family member or a helper who can help her get up every day, change her wound dressing or do whatever she needs to do, and you'll see the surrounding women really kind of group together and help that person out, and I think that there's such a solidarity amongst them. Profound thing that we've seen here that's been so striking is that you see the end result of a lack of access to care. A lot of these women, for example, are laboring in their villages or have medical problems that go unseen for even decades, and to kind of see the end result of that and how far down the road a disease or a pathologic state has gone, we just don't see this back home.
This is a very delightful 27-year-old who was quite well until about 3 months ago, when she started noting her abdomen was growing and she started having some pain and her menstrual periods stopped. She noted this continued to grow, and then she finally came to be examined and she was found to have these masses. The CAT scan wasn't available, but she did have ultrasound, which documents the masses, and not too much free fluid, so these are pretty much solid masses. I think one of the stickiest problems is that there is a pretty good chance that she might need some chemotherapy, and it's a bit hard to obtain. Some germ cell tumors, many of them, are very, very sensitive to chemo once you get out the tumor mass. We don't know yet, and she realizes this, I think, we don't know yet if it's operable, if it can be removed. The biggest problem as far as the surgery to get rid of this would be if this tumor has integrated itself into the mesentery of the small intestine, for instance. That's pretty tough to do. You can't sacrifice it. So you fight hard. You will? You promise? Tell her to fight hard.
What did I do?
Okay?
Thank you.
Okay. You gotta fight. Fight.
Thank you.
Okay. Barbara is now on the table, so we are moving ahead with the procedure. Have a great team working on this. It's not a quick operation by any means. We have several units of blood type, and so we're prepared for a significant procedure. Because the tumors were so big, we knew that she needed a very large incision to get these out. We weren't at all sure that they would come out because they were so large. We thought maybe these are fixed and embedded in the abdomen, and maybe this would not turn out to be a positive procedure at all. But when we got there and got in, she turned out to have two very, very large tumors, one from each ovary. Now, when you cut, you do not want to leverage
Torque it, because it'll tear the tissue.
It'll pull it out of the clamp. We don't know this. She had some other small tumors in the abdomen, nothing very big except one which was in the wall of the bladder and growing all the way through the wall of the bladder. So we did take that one out as well and repaired the bladder, closed it, and that will do well. After we were able to identify these tumors as being removable and contained within the ovary, the whole atmosphere in the operating room changed. Everybody breathed a sigh of relief.
That's such good news. This is that 1%, 2% that I told you why you would do the surgery. I mean, this doesn't have any adhesions, no evidence that it's, aside from the size, which is a risk factor, but otherwise it doesn't look malignant. It may be, but It's really good news, really good news.
So that's where we stand with this. We feel kind of good about it because there were those who saw the patient who thought there wasn't much chance to be successful at this surgery, and we are so glad that that wasn't the case. I was just a few minutes ago talking with one of the UCLA residents who scrubbed with us on the case, telling her what a good job she did. Both the residents said this is more than they could have ever hoped for in terms of being able to give something, to really give something in a place and to people who need it desperately.
There should be no question in someone's mind about whether or not to come here. It has been one of the most eye-opening experiences I've ever had, and I've been thinking a long time about coming here since the start of residency and what is it going to be like, and you know, I had all these ideas and expectations of what I might find here, and really you have no idea till you get here. I think it's really been wonderful for our learning as surgeons, operating on, number one, cases that we don't usually see back home and learning how to do that. And number two, learning to operate in ways that we're not used to, again, with instruments we don't usually use and improvising and all that. And it really has improved our surgical skill. It seems like the residents who are learning here are really invested in moving things forward and improving healthcare throughout their communities. So it's been ups and downs and just such a mix, and I think that it's just been truly remarkable.